Hello, everyone. Let's talk about hysterectomy risks and how it influences and impacts hair growth. Now, I want to talk to you about this image and hysterectomy associated with an increased risk of cardiovascular disease. Now, I have been on live streams, TikTok, Instagram, Facebook, YouTube, each week, talking about different ways how the body impacts hair growth. One way hair growth is affected is by our hormones. So the last 3 to 4 weeks I have been talking about hormones and hormone health. This Sunday I will be talking about hysterectomy, cardiovascular risk, and how it influences hair growth. So let's kind of break this down. I want to talk about this that I mentioned here today. Just want to point out some notes. This was based on a cohort study some years ago, but it still applies because women are still women. They've been women 20 years ago, and they're still women now. It was a cohort risk study of 2,094 women, and they found that when women had hysterectomies, 20 different comorbidities existed after they got this hysterectomy. So 20 chronic conditions develop as a result of this: coronary risk, blood circulation risk, hyperlipidemia risks, hypertension, obesity, cardiac arrhythmias, coronary artery disease. And that's where the arteries between our blood flow, the arteries will stiffen, they'll harden, and they will actually also start developing plaque in the arteries. What is not noted, which is why I'm here today, is you also suffer with hair loss, and I'm going to tell you why. The theory is because there's a lack of collateral blood flow that is flowing to the ovaries. If the ovaries are not working, they're not producing estrogen in the numbers that they were prior to your hysterectomy, it can cause a loss of density in your scalp hairs. When our levels of estrogen decline after a pregnancy, if they decline with age, if they decline because you're dealing with PCOS, if they decline because you've had maybe cancer, when there is a decline in estrogen, when there is a lack of blood flow to the ovaries, when there is a change or alteration in your hormones, anything that affects your hormones can affect hair growth here. So what I'm going to be talking about this Sunday is what we can do to try to manage pre-hysterectomy risk and what you can do after hysterectomies. So again, please research this information. If you like the article itself, I can send you the links to the article. But what I want to talk with you about is because of the lack of blood flow to the ovaries, when you remove a body part, such as a uterus and or possibly the ovaries, we're going to be talking about hysterectomies and oopherectomies. That's when you have everything removed. It will subsequently cause issues with your hair and scalp. It causes problems with your hormones. Whenever you affect hormones, your hair in the top of your scalp, the hormonal zone, which is above the eyebrow, will always be affected. Please like, follow, and share for more. Meet us here this Sunday, the 14th at 8 o'clock, TikTok, YouTube, Instagram, and Facebook. LaRon Quarles, I am a hair loss specialist and functional wellness specialist here in New Jersey. You have a wonderful day.